Good day, dear sir, madam. My name is Param Pierre, inventor, owner, director of Safe Flow LLC, a family-based medical device company. We were established since 27. Yes, 27. I invented the infant trachea device in 2012. Also in 2012, I invented a positive pressure device for adults. Due to similarities, the second invention was not granted. Moreover, the publication can be seen on www.ecopap.org. The Ecopap system provides instant PEEP therapy for patients suffering from asthma, getting air out, hypoxemia, getting oxygen in, and viral pneumonia such as COVID-19. PEEP therapy for this device can only be established by mechanical ventilation. The Ecopap system uses positive pressure only. No electricity or battery are necessary. Positive pressure systems are established in hospitals, nursing homes, and emergency EMT systems. This positive pressure, which can be established through flow meters, as you see, E-tanks, small transportable systems, 2 to 15 liters, H-tanks, 2 to 15 liters per minute. PEEP therapy is well known in the medical system. This device, the first of its kind, provides this mandatory life-saving modality. A simple nasal prong connected to the Ecopap system uses with air, oxygen, yes, and nitric oxide. Will inflate the lung and allow passive exhalation through atmospheric pressure. My profession as a registered respiratory therapist for 38 years provided knowledge of breathing patterns and lung diseases. During my scheduled rotation working in neonatal units at the Brooklyn Hospital at NYU, I encountered infants who required supplemental support and liberation from mechanical ventilators. A check valve connected to a tubing attached to oxygen immediately came to mind. A PEEP valve was later attached to the device, and I created a drawing of the device, intuitively imagined the process alleviating breathing difficulties. The current problem which I witnessed was the overuse of mechanical ventilators, which can cause dependency, ARDS, respiratory distress syndrome. The mandatory dependency of electricity or battery associated machinery will be avoided. This device provides PEEP therapy and allows the patient to breathe more physiologically and economically beneficial to our environment. The present invention relates to a positive pressure device used for the E-source, 8-cylinder airflow meters located in all medical facilities. All medical devices which supplies transmission of flow 2 to 60 liters per minute facilitate the use of this Ecopap device. The flow is transmitted to the lungs via inspiratory tube and a one-way valve placed within the tube. This one-way valve will not allow exhale lung volume to return through the inspiratory tube. Nasal prongs provide this non-returnable volume to communicate with the patient via nares. The expanding lung volume follows the passive least resistance, which is through the exhalation tube. A pressure manometer is placed within the exhalation tube, monitoring the exhalation volume. A PEEP valve is placed distally within the exhalation tube, resisting the exhale volume, creating PEEP, positive end expiratory pressure, while maintaining lung expansion, allowing a predetermined pressure release measured 5 to 30 centimeters of water to atmospheric pressure. The device applies continuous air pressure to maintain adequate lung volume and promote alveoli recruitment, providing a continuous release phase to low pressure and the removal of secretions. This alternative lung recruitment approach provides patients to spontaneously breathe and provide oxygenation and decrease work of breathing safely. This is the device connected to a flow meter, a E-tank, H-tank, and specifically with the material used, we could use this for high flow distribution. As we see on the manometer, we could increase the PEEP. As you see the pressure going up. And because this is a nasal application, we don't have to worry about lung injury. Yes, this device, the first of its kind, was established. And the first patent, United States patent, was for the intratracheal device. CAD Designs was created. With prototypes. Like I said earlier, this device has a baby brother or sister, which is the infant tracheal device for infants, which can be seen on the web page www.ecopap.org. Stages of development. We have CAD designs, we have prototypes. We're looking for flow testing and ISO certification. Due to our financial obligations and minimal outreach, we require funding. Failsafe was recently established. Our original company was PG Deliverance. But because of the IRS, they claim I was a hobby, because we really didn't do anything as yet. That's why MedTech is so important for the establishment of this device. As you could see, the lung cannot be deflated, and we monitor the lung pressures at all times by increasing or decreasing the PEEP, depending on the patient's need. Now, because of the specifications, this device was specifically for high flow systems requiring 30 to 60 liters per minute. The plastics were specifically FDA approved, and it seems to be working perfectly. I even tried it on myself. This is a safe device which uses nasal prongs for the adults, and for the infants the process is similar. We have micro check valves. So, as I stated earlier, this device can be used for transport, emergency transport, instant lung insufflation. With this application, many lives can be saved. I was introduced to MedTech years ago, and I saw the application, which I'll be filling out and sending over to you. But I just wanted this to be a prerequisite for our discussion and possibly MedTech taking this device on. This device is safe, is economical, and will save many lives. Thank you again. We'll be talking shortly.